Hey YouTube, welcome back to New Skin RN, where wound and ostomy care is made simple. So today I wanted to do a super quick video on convexity. In other words, why would you need to use a convex pouch versus a flat pouch? But in order for you to understand that, you need to see what a stoma ideally looks like. So take a look at this picture. Now, it's important to note that sometimes it is not possible to get this type of outcome because it depends what happens, what they find during the surgical creation of a stoma. Okay, so some patients, it's just not possible for it to end up like this for various reasons. But the bottom line is, ideally, this is what a stoma looks like because, first of all, it protrudes or sticks out. And when this happens, it allows urine or stool to flow into a pouch with ease. And also, it's located on a flat surface. Again, when this happens, it allows for stool or urine to fall into the bag better versus being located within a crease or an abdominal fold. Okay, so just keep this in mind that this is ideally what a stoma looks like. When that happens, then you are, in most cases, able to get away with using a flat appliance with no issues. The problem becomes when you have a stoma that looks like this, okay? So instead of it being protruding, okay, it now is flush with the skin, level with the skin, or worse, it retracts. When that happens, now stool and urine has a harder time flowing into the bag. And in fact, what happens is, especially when you're using a flat pouch, in that scenario, it now flows behind the pouch instead of into the pouch. And in fact, this is what causes many of our ostomy management challenges, is this very issue, okay? So in a case like that, you now need to start thinking about something called convexity. And as you can see here, you can see that there's a bulge, a curvature to it. And that's what convexity is. And this is meant to provide support to a stoma that is flush or retracted and having difficulty with emptying into a pouch. And so here's some things you need to know about convex appliances. The effect of the convexity can be enhanced if you use a support belt. Okay, and depending on the manufacturer, there are different types of convexity. And so for that reason, it's very important that you do not use a convex appliance without speaking to a WOCN, a wound ostomy continence nurse, or a physician. Because if you're not using the right type of convexity, or if you're using it improperly, you can actually develop peristomal skin damage, such as pressure injuries. And you don't want that to happen, okay? You really don't want that problem. So, just keep in mind that convexity tends to be more rigid, and that's why you have the possibility of peristomal skin damage if you do not use the right type of convexity, depending on how your abdominal contours are. Okay, so that's really it. Just wanted to bring awareness to why you would need to possibly use a convex appliance. Always speak to a specialist before you do so, and look for me on social media. If you're looking for more ostomy care tips, visit my blog where I have so much information about these issues, and I hope to see you soon. Take care. Bye-bye.